Hi everybody, my name is Anthony Reffi. I'm a clinical psychologist currently on postdoc at the Thomas Roth Sleep Disorders and Research Center at Henry Ford Health System in Detroit, Michigan. I'm excited to work with ISTSS as part of the Education Production Committee on this month's Friday Fast Facts, during which we will discuss the relationship between sleep, trauma, and PTSD. We deliberately use the word trauma to emphasize that sleep has far-reaching effects that extend beyond PTSD. Of course, sleep is related to risk for PTSD, but it is also involved in depression, substance use, and suicidal behavior following trauma. So, even though lots of the work we highlight focuses on sleep and PTSD, sleep is transdiagnostic, which is to say it has a hand in the many ways we react to traumatic experiences. Personally, I'm thrilled to introduce this topic because I'm passionate about trauma resilience and recovery from PTSD, and I firmly believe sleep is an indispensable piece of this puzzle. I became interested in sleep's role in trauma recovery while treating PTSD in veterans at the Hines VA in Chicago. During that work, veterans would routinely express their dissatisfaction with their sleep, from not getting enough of it to suffering from chronic nightmares. And from what I saw, these sleep disturbances were putting them at such a disadvantage when beginning treatment, like prolonged exposure. To appreciate the importance of sleep in this context, just think about a bad night's sleep you recently had and how it left you feeling the next day. Maybe you were much more irritable than is normal for you, less patient, more anxious, and unfocused. Now, imagine while you're feeling this way, being asked to retell the worst experience of your life in vivid detail and repeatedly. It doesn't take long to realize just how difficult that would be. And that's exactly why, over the next month, we'll be disseminating the following materials on this topic: a research brief, a clinician fact sheet, and an infographic. I just want to take a moment to touch on the clinician fact sheet. This will cover information on the 3 sleep disorders that most commonly co-occur with PTSD, and these are insomnia, nightmare disorder, and obstructive sleep apnea. If you read nothing else, I hope that you check this document out, because these sleep disorders are modifiable barriers to treatment that we could remove with the right training and clinical tools. Yet, despite clinical psychologists' unique opportunity to treat these sleep disorders, most of us here in the US don't receive any formal didactic or clinical sleep training. This is also true for US medical residency training programs. So, the clinician fact sheet provides tips on how to screen for and treat these sleep disorders using first-line interventions as recommended by either the VA or American Academy of Sleep Medicine. It's important to emphasize that the screeners listed in the clinician fact sheet are just that, screeners, and they should not be used to diagnose any of the sleep disorders discussed. There's links to more resources in the clinician fact sheet on how to properly diagnose these sleep disorders and how to receive training in behavioral sleep medicine. Finally, all of these materials will be publicly available on the ISTSS website under our Friday Fast Facts page, which is listed under Public Resources on istss.org. There, you will also find all of our previous Fast Facts topics. You may also keep up with the Friday Fast Facts by following ISTSS on Twitter at ISTSS News. Be sure to check out the Sleep Disorders and Traumatic Stress Special Interest Group, which is also on the ISTSS website listed under Membership. With that said, I hope you enjoyed this month's topic and find the materials useful.